If you're frustrated from working years of long unpaid hours, sacrificing your health and well-being for your career as a nest leader, only to realize that the cup has run empty and now you're grappling with the frustration of working under someone else's demands, compounded by feeling as if those years of dedication are not being adequately financially compensated. In this video, I'll show you how to go from nurse burnout to time plus location freedom through nurse consulting, even if you're a beginner with no business experience. Can I ask for a favor? Hit subscribe for more videos on how to regain control over your time, income, and make an impact through nurse consulting. I've used the same strategies I'm sharing with you today to go from burnt out, frustrated, stuck, and struggling nurse manager to having control over my own work schedule, flexibility to work from anywhere in the world, whilst making an impact through nurse consulting. Nurse burnout is at an all-time high because the amount of stress that nurses endure during their career is classified as an occupational hazard. Unfortunately, the system is not designed to relieve or to solve or to reduce these stresses. As a result, we learn to work under stress, but you can only endure that for so long. And now you've reached a point where the cup is empty, there's nothing to pour from, you're frustrated, you're emotionally exhausted and just worn out. You know it's time for a change because you feel as if you've reached a career crossroad where a lasting shift has to happen. In the past, you have solved this problem by going from one job to the next, and inside you have suspected that the path to lasting freedom is running your own business, and you've probably dabbled in starting other businesses like I have, but none of them gave you lasting financial compensation for what you did, and they didn't bring the level of satisfaction that comes with using your expertise to actually help people solve their problems. This is where nurse consulting comes in, because as a nurse consultant, you use your clinical and leadership expertise in order to solve problems for healthcare companies, pharmaceutical companies, insurance providers. It might be legal companies or attorneys. The areas in which nurse consultants work and the areas in which they are needed is very vast. The demand for nurse consulting has been going up and increasing because of the astronomical number of experienced nurse leaders who are leaving the profession entirely. Unfortunately, after the pandemic, nurse leaders really felt as if they had nothing left to give because they were giving a lot. It was just give, run. And, we were critically short-staffed. And after a while, you just cannot continue going. This has left gaps in healthcare leadership, and it's contributing to, revenue loss within healthcare organizations, high risk to patients. You hear horrendous stories of people who go to hospital or healthcare facilities and, nurses end up making mistakes because the structure to support quality healthcare delivery is just not there. This is where you come in as a nurse consultant. Instead of quitting and starting from scratch, you're simply continuing with what you've already built and transforming that expertise into income. In my opinion, it truly is the fastest way to time freedom, making an impact, and scaling your income as an experienced nurse. Why nurse consulting? Well, once you land your first client and you learn the skill set of onboarding a new client, the opportunities are endless. When I first transitioned into nurse consulting, I literally landed 2 amazing long-term healthcare clients within a space of a few weeks. It opens up to you a world of opportunities that you never had in your job. It gives you full control over your time, schedule, and it gives you flexibility. You decide your work hours and how you work. Even if you start off working physically at a facility, you can develop a trusting relationship with your consulting client, and over time you can move your operation to be fully remote. Instead of being stagnant with nurse consulting, you keep on evolving and growing. If you start off as a clinical nurse consultant, for example, in 5 years you might be an entrepreneurial nurse consultant and building online platforms or selling online programs to new nurses. So it just positions you in a way that gives you the ability to expand your horizons as the years move on. Of late, I've been speaking to a lot of US and UK based nurses who are actually relocating to the Dubai Arab Emirates because of the growing demand for nurse consultants in the Arab Emirate region. So again, nurses who practiced in America, in UK, they now have an opportunity to just travel across the world offering their expertise. You have a normal workload and are no longer expected to do excessive unpaid overtime. As nurse leaders, we do need to break this culture of feeling as if in order for us to do our job well, we need to be working 12 to 13-hour days every day. It's not sustainable and it's not practical. As a nurse consultant, every hour is accounted for. You're paid based on your expertise and value, not the amount of hours, and that brings us to the ability to scale your income. The moment you become a nurse consultant, your value goes up. Therefore, the money you earn also increases. You determine your own rates, and as your confidence and expertise increases, you can also increase those rates. You can even take yourself away from the equation by having a consulting firm and subcontracting services to other nurse consultants. This enables you to grow the business and dissociate the relationship between your income and time and scale it into a legacy business that can even outlive you. It's such a powerful way of making an impact in nursing and bringing the excellency of the expertise you've acquired to solve current healthcare problems. How do you get started as a nurse consultant, especially if you're a beginner? There are 4 phases to getting started as a nurse consultant. Phase 1 is setting a vision and a time frame. What are your goals? Where do you see yourself as a nurse consultant? What do you want to achieve? If you could picture yourself 6 months from now and have your ideal situation, what does it look like? What are you doing on a daily basis? What value are you providing? What problems are you solving for the clients that you're actually working with? So really have a vivid vision for where you want to go and then set a time frame. I encourage a 90-day time frame. But you're an adult, you can make it 6 months, you can even make it a month. If you need a guide to help you go from a place of burnout, stuck, frustrated, empty cup, nothing to pour from, and really needing to change things so that you can have flexibility and full control over your time whilst making an impact, then book a free consultation with me and we can see if you're a good fit for us to work together inside the Nurse Consultant Blueprint so that we can help you transition into a successful nurse consultant. Second phase is for you to uncover and package profitable consulting services for you to offer. How do you do this? By following these simple steps. First of all, have a look at your personality. You want to build a purposeful, fulfilling nurse consulting business that you're excited to work in each and every day. And that starts with understanding who you are as a person. Many people miss out on this and build careers that they resent and hate because they never took the time to work out and understand what is aligned with them. When it comes to you, what are your strengths? What are your weaknesses? And if you do not know your personality type, you can go to the Neris Type Explorer test. It's similar to the Myers-Briggs test, and I like it because it's very accurate and relevant, especially to what we do as nurses, and it will show you the environments in which you thrive and where you do not thrive. Use that as a starting point to the services that you're going to offer. Remember, we want you to excel as a nurse consultant, and excelling comes from being excited and passionate about what you do. This is also going to help you if you've reached a point where you have lost your passion. You've even forgotten why you set out in nursing in the beginning. You don't need to quit nursing entirely. It's a matter of just refocusing and recalibrating, and understanding your personality is truly the first step in helping you do this. Second, your experience. Look back on the projects you've worked on over the past 10, 20, 30, 40 years. Look back on what it is you've achieved. Look back on where you have excelled. What sort of work did you do that made you even forget about time, where you never look at the time when you're doing this because you're so passionate about those things? For example, You might be passionate about leadership development and training new nurses and, creating training packages that enable them to thrive and stay within the nursing profession for longer. Or maybe you are the queen of compliance when it comes to heavily regulated industries. So HK, for example, heavily regulated, high accreditation standards to abide by. If you are the person who comes in and helps a provider who has been sanctioned or is losing their accreditation, and you help them regain their accreditation status, or you help increase their quality standards, or maybe you are the expert when it comes to identifying clinical risk and introducing workflows and processes that minimize risk to clients, or maybe you excel when it comes to budgeting, cost cutting, and reducing waste. List it all down. Third step in uncovering profitable consulting services is identifying the big problems within your specific nursing niche. List down the major problems that healthcare providers within your niche are experiencing. If you don't know what those problems are, you can uncover them by, first of all, listening to what the locals in your area are saying about healthcare providers or what staff members are saying. This is a really good indicator of the problems that have been experienced. Second, go to regulatory websites. Third, go on Google and look up the news. So if you type in your specific niche problem, problems in XXX specific niche, and then click on news under Google, and that will come up. Look up LinkedIn news and see what people are talking about and saying. I want you to come up with a minimum of 10 problems. Remember, you are a nurse consultant and your primary goal is to solve problems. Lastly, validate if there's an actual need for these consulting services by speaking with healthcare providers and asking them about the problems that they're facing. Do not assume that you know the answers. If you want to set yourself apart as a successful nurse consultant, you will become an expert at listening to and really being thorough about understanding the problems healthcare providers are facing. Write down in their exact words what these challenges and problems are, and ask them if they are in need of those services that you're thinking of providing. Phase 3 is mastering client acquisition. The fastest way to secure a client, and I know I say this a lot, is to do it in person. But if in person is not possible, then you can schedule a Zoom interview or telephone as a last resort. You want to use the means that enables you to establish trust the fastest. And then phase 4 is develop a framework for solving client problems and a lean workflow. As a nurse consultant, a mind shift is required. You're no longer an employee, you're now a business owner. You manage your own time and you have processes in place for delivering on client work. Be that person who is excellent on delivering on timelines and project requirements. If you're ready to have control over your time, flexibility, and scale your income through independent nurse consulting, then book a free consultation with me. My calendar is in the link, and we'll see if you're a good fit for us to work together inside the Nurse Consultant Blueprint. Do subscribe and like this video.